Have you ever worked in an organization that can't seem to get out of its own way to serve more people and grow? I have a couple. Very painful. Very, very painful. Most organizations want to grow, but not all organizations do what is necessary to grow. That's what we're going to explore a little bit today. My passion is working with home care, hospice, and health service organizations to help them serve more people and grow. That juices me beyond belief. And as I work with these organizations to help them serve more people, I'm actually having a direct impact on helping thousands of people get the care services that they need at a very vulnerable time in their life. Wow, that is pretty cool. I wake up every morning, go to bed every night working with organizations to help them redesign their service delivery modules, serve more people, and grow. Most of the calls I get from hospice organizations are when they hit the wall and stop growing, or even worse, start to decline. As I talk with these organizations and hear their stories, there's a common theme of the reasons that they believe they stopped growing. See if this sounds familiar to you. Oh my God, the competition is unbelievable out there. 2, the regulatory environment has become intensified. We're spending all of our time to be nothing but compliant, working on compliance issues. 3, reimbursement is going down. It's hard to put any money into growth, business development, etc. Now, while some of these reasons may be true, and I underline maybe, I submit to you the reason organizations stagnate in their ability to grow is because of internal factors. And what I mean by that, as we sit here today, back in our respective organizations, there's these internal barriers. I call them the invisible velvet gloves on the spigot of growth. People, processes, systems that are just not working. So if you have people, processes, and systems that are doing well, man, that spigot of growth is flowing. You got a ton of referrals coming in, and life is good. If you got dysfunctionality, broken systems, and the people on the bus that are in the wrong seats, oh my God, that spigot is closed off to a drip. That's what we're here to discover and look at. What are those internal barriers, and then how do we blow through them? I call it barrier busting. In the 35 years I've been a healthcare executive, I've identified 7 pillars of growth that are essential for a high-performing organization. And we want to spend a few minutes talking about the first pillar, which I believe is the key to all the rest of the pillars. That's the pillar of creating a culture of growth. For me, that's the glue that holds the rest of the pillars together. And it's the one that really addresses that invisible velvet glove, all those internal factors. As I talk with healthcare executives around the country, and I say, well, we need to focus on creating a culture of growth, they say, well, that's a business development strategy. What does it have to do with us? Creating a culture of growth is anything but a business strategy. It's an organizational strategy of excellence. And it begins with leadership understanding. Do we have a high or low culture of growth? Doing a diagnostic. And then looking at the corrective measures to impact that, to fortify it or enhance it. And then as I work with these executives, we need to look at 3 important fundamental elements to developing this pillar. 1, having an excellent service, excellent strategy in place. And then train to service excellence. 2 is being able to really look at the roles and responsibilities of everybody in the organization to support growth. 3 is having a philosophy and a systematic approach to continuous quality improvement, because that's what supports the processes that are so important for us to nurture to stay healthy and keep that spigot open. And if an organization is able to install that first pillar, creating a culture of growth, you will be successful in not only meeting your mission and business objectives, but becoming a valuable community resource. Thank you.